I'm Dr. Paul Fisher from Innovative Nerve and Joint Centers. Thank you for being here. For those of you who are concerned that you may have neuropathy, please download our neuropathy guide below. For those of you who are concerned you may have sciatica, please download that guide. And if you think you may have both, well, you know what to do. Today, we're going to tackle an issue I see with patients all the time. How do I know if what I have is neuropathy? Or if it's sciatica? Or perhaps you've been diagnosed with one of them, but treatment isn't helping. The explanation you're getting doesn't make sense, and you found this video because you've gone down a rabbit hole. Maybe your feet burn at night. Maybe your legs tingle when you sit too long, or you get a shooting pain when you go from sitting to standing, or vice versa. Or maybe you get those electric lightning bolt jolts of pain shooting down your back into your leg when you make that one random move. If that sounds familiar, you're in the right place. By the end of this video, you'll know what neuropathy is and what sciatica is, why their symptoms get mixed up so often, the key signs that help tell them apart, the root causes behind each condition, and most importantly, what you can do about it, why this matters. Every week, I meet patients who've come in already convinced they've figured it out. Some say, "Doc, found you online, I've got that neuropathy you talked about, getting this horrible pain going down my right leg." But after a careful exam, it turns out their pain is actually coming from a herniated disc, causing a compressed sciatic nerve in the lower back. Others swear they've got a pinched nerve, when in reality, their nerves have been damaged over time from diabetes or chemotherapy. And then there are the tough cases where both conditions exist together. That's a double burden, and it can make daily life really challenging. So why does this happen? Because the symptoms overlap, and when you're hurting, it's natural to just want answers. But the truth is, neuropathy and sciatica are very different problems, and they require very different solutions. Neuropathy versus sciatica. The simple comparison. Let's break it down side by side. A little background though, because I like details. The definition of neuropathy is damage to a nerve. Strictly speaking, sciatica is a neuropathy. We're really referring here to peripheral neuropathy, which is the damage to the nerves outside the brain and spinal cord. There's a more in-depth video link down below. Sciatica is irritation of the sciatic nerve, which runs down the back of your leg. This irritation can be caused by nerve roots from disc herniation, spondylolisthesis, canal stenosis, muscle spasm, and a whole host of other issues. I'll do a more in-depth video on this in the future, and when I do, I'll link below. Now back to the difference. Neuropathy is nerve damage, usually at the far ends of your nerves, like in your feet or hands. Causes: diabetes, alcoholism, chemotherapy, vitamin deficiencies, poor circulation, toxic chemical exposure. It tends to affect both sides of the body. The symptoms build gradually, often over months or years. It's not affected by posture or position. Standing, sitting, or lying down doesn't make a huge difference, although sometimes lying down at night to go to sleep can cause problems, explained in another video link below. Sciatica, on the other hand, is nerve irritation, usually pressure on the sciatic nerve or the nerve roots that form it, which runs down from your lower back all the way down your leg. Causes: bulging discs, spondylolisthesis, spinal misalignment, spinal stenosis, muscle spasms. It's often linked to a history of back pain or injury. Usually affects just one side, the right or the left. Pain is positional. Bending, twisting, or sitting too long can make it worse. So the shorthand way to remember this: neuropathy, damaged nerves; sciatica, pinched nerves. It's not 1000% anatomically correct, but it's a good shorthand. Now let's go deeper into what these conditions actually feel like. Neuropathy symptoms: tingling, burning, stabbing, or pins and needles in the feet or hands. Pain that tends to be worse at night. Numbness or loss of sensation, which can lead to balance problems. Sometimes muscle weakness, although this is less common. Usually tied to metabolic issues like diabetes, chemotherapy, or nutritional deficiencies. Sciatica symptoms: sharp shooting or an electric pain running down the leg. Rarely will happen in both legs with certain conditions. Pain that worsens when sitting, transitioning between positions, bending, or lift. Often starts in the low back or buttocks and travels down. May include numbness, tingling, or muscle weakness in the leg or foot. Symptoms often change depending on movement or position. Many times too, sciatica is worse if it's due to a disc herniation first thing in the morning. If your pain starts in your back and shoots down one leg, sciatica is more likely. If your feet constantly burn, tingle, or feel numb on both sides, neuropathy is the stronger suspect. We had a patient last year who came in for our neuropathy screening, had been diagnosed with neuropathy, but when we performed testing to assess the severity, the numbers weren't adding up. She had risk factors for neuropathy, was a diabetic, poorly controlled blood sugar, but it just didn't make sense. Then we performed orthopedic tests to check for sciatica and it lit her up. We treated the disc herniation that was causing it with laser, and 3 months later, she was a new woman. Root causes. What's really happening? Neuropathy is usually metabolic or systemic. High blood sugar and diabetes damages the small vessels that feed the nerves. Chemotherapy and certain medications can damage nerves directly. Poor nutrition or deficiencies rob nerves of what they need to function. Over time, these stresses break down the nerves. They start misfiring and sending the wrong signals. That's when symptoms appear. Sciatica is usually mechanical. Picture a garden hose. If someone steps on it, the water flow is cut off. In sciatica, something is stepping on your nerve. A herniated disc, a misaligned vertebra, tight muscles. The result is pressure on the sciatic nerve, and that pressure is what creates the pain, numbness, or weakness down the leg. Remember, some people have both. You can have neuropathy from diabetes and on top of that, a pinched sciatic nerve from a disc problem. That's why guessing is dangerous. You need a proper evaluation to know for sure. So what are the treatment approaches? Now here's where things get critical, because neuropathy and sciatica may look similar on the surface, but the treatments are very different. For sciatica, the goals are to reduce pressure and stabilize the spine. Chiropractic adjustments to realign the vertebrae. Spinal decompression therapy to relieve pressure on bulging or herniated discs. Stretching and mobility work to free up tight muscles. Core strengthening to support the spine long term. For neuropathy, the goals are to improve nerve health and circulation. Blood sugar management and nutrition to protect nerve tissue and decrease inflammation, nerve stimulating therapies that help restore nerve function, techniques to boost blood flow and oxygen delivery to the nerves, balance and coordination training to reduce fall risk and improve quality of life. One of the biggest mistakes I see, people try to treat neuropathy with sciatica stretches, or they take neuropathy supplements when their real issue is a pinched nerve. And of course, nothing improves because they're treating the wrong problem. That's why in our clinic, we use advanced diagnostics to figure out exactly what's going on before we begin treatment. Now let's take a moment to answer some of the most common questions I hear. Can neuropathy be mistaken for sciatica? Absolutely. The burning, tingling, and numbness can overlap, but the key difference is that neuropathy usually affects both feet, while sciatica almost always affects one side and starts in the back. Can you have both at the same time? Yes, and I see this more often than you'd think. That's why diagnosis is so important. If you only treat one condition but not the other, you won't get full relief. This can happen often in patients with spondylolisthesis. Not sure what that is? Check out the video I made below. Is neuropathy permanent? It depends. Neuropathy can sometimes be slowed or even improved, especially when caused by things like vitamin deficiencies or blood sugar imbalances. It's a progressive disease though, and the longer it goes untreated, the harder it is to reverse. Does sciatica ever go away on its own? Sometimes mild sciatica resolves with rest, stretching, and activity changes. But if it lasts longer than a few weeks, or if it's severe, it's important to get evaluated because long-term nerve compression can cause permanent damage. So here's a quick recap. Neuropathy. Damaged nerves, usually in both feet or hands, tied to systemic issues. Sciatica, pinched sciatic nerve, usually one-sided, radiating from the lower back. Treatment, different for each. Don't guess, get diagnosed. Here's the big message I want you to walk away with. Pain may be common, but it's not normal. If your feet burn at night, if your legs tingle, if you've got that shooting pain down one side, don't ignore it. The right diagnosis and the right treatment can help you take back your mobility, your independence, and your quality of life. If this sounds familiar, click schedule appointment button below. My team and I would love to help you uncover the root cause of your pain and build a treatment plan that actually works. And if this video helped you, please hit like, leave a comment with your experience, and don't forget to subscribe for more health tips and solutions. I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers. Thank you for watching.